Thank you all so much for joining us today. We're excited to have you here. We have a very action-packed presentation today. I just want to make sure, if you were expecting to just sit down and get information today and not participate, this is not the session for you. So now would be a good time. They closed the door, sorry. It would have been a good time for you to get up and relocate and go to a different session, because we're going to have you interacting today, and not just via questions or comments, right? Because a lot of what we talk about today are real tangible things that we would like for you to take with you to continue to ensure that your space remains safe for those that you serve. And so I'm going to pass it over to my partner in crime while we do quick introductions, and then we'll tee it off with a roll call.
He says partner in crime, but that's my boss. So, my name is Julia Andrews, and I'm the director for the Center for Safe and Secure Schools. We have been around since 1999. We were established immediately after Columbine at the request of our superintendents. And since I've been director 3 years, 2 weeks ago, was my 3rd year anniversary, we are really excited to be at the table for school safety. Unfortunately, we have been around since 1999, but we haven't always been used in the space of preparedness. We're kind of the reactionary for our school districts. Since Uvalde, we are now the preparedness. We are at the table, and you'll learn a little bit more about the decisions that are occurring with our school districts within Harris County and how we plan to make them safer. Before I go any further, I have a few introductions. Our board president, Mr. Richard Cantu, is here. Thank you so much for being here. We have my specialists, my mighty team of 2, Sasha and Janice, and you'll hear from them a little bit later at the end of the presentation. They didn't know that. And then we have our communications team. I just want to thank you all for being here. They're in the back. As you can tell, Harris County is really excited to support the initiative, especially when we talk about school safety.
And I'm sorry, I always do this. I always forget to introduce myself because I'm so excited to jump in. My name is Dr. C.J. Rogers, and I'm the Assistant Superintendent over at Harris County Department of Education. And so really quickly, as we get started, I just want to do a roll call. DJ, can I get a little background music? You know, we got to get this thing loosened up a little bit. Yeah. So when they said that. So roll call. So any law enforcement, please stand up. Any law enforcement today? Okay, all right. How about we just give them a round of applause, just, for all that they do. I'm calling out our public servants because you all are public servants. And so I just want to do a quick roll call, continue. Any educators in the building? Any educators in the building? Come on, stand up, give them a round of applause. Yeah, they are. Many of them are at work, so we're shouting out them online. Any public health officials? Yep, come on, stand up, give them a round of applause. Awesome. Nonprofit in the room. Yeah, here we go. Come on, let's go. Shout them out. Give them some love. Government agencies. Any government agencies in the room? Yeah. Good. And last but not least, our community servants. So those folks who serve our various communities. Any? Yeah. Anybody that I missed? I love doing this part. Who? Come on, shout them out for me. Youth programs. Come on. Yep. Crime prevention. Good. Yep. People are like, man, you keep calling me up, man. Come on, what's going on? Texas fans. Look. Okay. Shameless plug here. I'm sorry, I gotta do it. Any Chicago Bear fans here? There we go. Hey! It's about the only cheering we're gonna be doing this year, but that's okay. It's all right. So I'm going to turn it back over to Julia to go over the objectives. So if we can go back to the objective slide.
Nope, that's probably me clicking the wrong thing. I'm learning, y'all. Excuse me. Our objectives for today: understand how to build a safe and supportive environment using school safety best practices. That might be me. No, I'm not clicking. Do you want me to? Is that me messing that up? Back to objectives. Okay, I'll go back. Okay, there I go. And our last one: identify and improve areas of weakness. No, I'm not touching it. In K through 12. So we are educators, so we're going to go with the flow. And as I stated earlier, a little bit about the Center for Safe and Secure Schools. If you're sitting at one of your seats, you have a handout of our support services that we offer and provide. We are not just about physical safety, so the hardening of the schools. We also provide emotional safety support and resources for our school district. So we can't ever talk about school safety until we talk about the hard work. So we can harden our schools all day long, but if students don't feel comfortable inside the school, they will not learn. We know that African proverb, I say it almost daily. When students do not feel the warmth of their community, they will burn it down. So with that being said, Dr. Rogers has a quick activity talking about the importance of connections.
You heard us say quick activity, right? You heard us say, no, I'm messing with you. Can we go back one slide, please? Okay, so here's the deal. I told you guys coming into this that you will have to get up and engage. So this is the opportunity for you to get up and engage. So everyone should have, you don't have to come up to the front, but everyone should have a We Connect cards. I love these cards. This is, again, they haven't paid me to promote them, but these are great cards to get up and, connect with one another. So here's what I want you to do. You're going to have 10 seconds to find a partner in an open area of the room. All right? So the first thing you need to do is just find a partner. Now, I'm an educator, so I'm going to throw a wrinkle in here. It cannot be with somebody that you know. So don't try and partner with the person sitting next to you. Get up, stand up, find a partner. I'll know that you have a partner because you'll be standing up and you'll be standing side by side with that partner. You only have 10 seconds to do so, though. Ready, go. 10, 9, 8, 7, 6, 5, 4, 3. Raise your hand if you still need a partner. 2, 1. All right, awesome. It seems like everybody has a partner, and you guys have done a great job of doing it in less than 10 seconds. Awesome job. Okay. If you don't have a partner, raise your hand. Love it. Perfect. Now, here are your directions. You have a card, correct? Raise your hand if you don't have a card. Okay, I'm going to get you a card. Now, on the card, there is a question. Every card has a question. You're actually going to flip it over, and then there's an exercise on the back. Now, here's what you are going to do. You are going to count to 3. Can I have a volunteer? Carlos, right? Felipe, I'm sorry. Felipe, you're going to look at your partner, and you're going to count to 3. You're going to say 1, 2, 3. And on 3, you're going to start doing that exercise. So if your exercise is rolling your arm, you're going to start doing your exercise, okay? You don't do anything else but your exercise. You do one other thing. You have to make eye contact as you're doing your exercise. You really are going to connect. Now, if it's a very intricate exercise, because some of these get out of whack, you can modify it, okay? You can modify it. So I don't want you up there trying to balance the whole time. You can modify it. But you got to count to 3. You got to do your exercise, and you have to make eye contact. All right, ready? Go. Again, make sure you just try your best. Make sure you're making eye contact. Make sure you're making eye contact. There you go. Shake that leg. Stretch that tricep. Get those hip circles down. And we're going to stop in 5, 4, 3, 2, 1. Great. Give your partner a high five, please. Blam. Good. Now, hold on. Now you got 10 seconds to find another partner that you don't know. Go. 10, 9, 8, 7, 6, 5, 4, 3, 2. Raise your hand if you don't have a partner. Raise your hand if you don't have a partner. We need someone in the middle. We're looking for a partner. Raise your hand. I think behind you, you have your partner. All right. Now, same thing, but don't forget, count to 3. A lot of y'all just went into y'all exercise like, I'm ready. No, we're not playing double dutch now. Come on. Count to 3. Do your exercise. Make eye contact. Ready? Go. I'm trying to not drag you. 10, 9, 8. Start wrapping up. 7, 6, 5, 4, 3, 2, and 1. All right. Before you leave, that was the last round. So before you leave, I want you to do 2 things for me. First thing, thank your partner for connection. So tell them, thank you for connecting. And then give them a high five, too. Bam, good. All right. You can go back to your seats. Now, here's what I would like for you guys to do. First thing, can you pass the cards all the way down to the end cap here so I can just come down and pick them up? The second thing, and my team always gets on me about this. They're like, oh, we always have fun, but then you make us think. Yes, that's the whole purpose. So you just have fun. Now it's time for you to start thinking and applying. Okay, so here's what I want to do. And you're just going to have a small little discussion in your row here, all right? First question that I want you to think about and I want you to answer together in your row. What was the most uncomfortable part about that activity? What was the most uncomfortable part about that activity? Talk in your rows. Talk in your rows. What was the most uncomfortable part? Okay, can I get a couple share outs? Can I have you stand and share out? What was the most uncomfortable part?
The eye contact.
Yeah, the eye contact. Yes. I'm gonna run out of cord line.
The physical exertion. I'm not used to working out. I don't like that.
Yeah, the physical exertion, like the activity was actually tough. The eye contact was tough. Someone from this side, what was the most difficult, most uncomfortable part? What made you the most uncomfortable during that activity? Time? Yeah. You want to know what's crazy? You only did that for 45 seconds. And even the second time, I had shortened it to 30 seconds. You know, hey, they say hold a plank 2 minutes now. Nobody was planking in it. No. Good. Second question. Here's what I got. The eye contact, the amount of time it took, right? And the physical part of it. Those are 3 key points. I'm going to tie it all together for you in a minute. Second question. What did you do? Because I didn't give you any guidelines. I said you only have to do 3 things. That's it. You have to count to 3. You have to make eye contact. And you have to do the activity. You have to do whatever the exercise was. What did you do? Because most of you felt uncomfortable. What did you end up doing to make yourself feel more comfortable? Before you answer out, talk in your roles. Talk in your roles. What'd you do to make yourself comfortable? What did you do to make yourself comfortable? Okay, let's come back together here. I had some folks over here who wanted to share out. You want to share out? What'd you do to make yourself feel comfortable? Can you come to the mic? Because it will go all the way back. All right.
Okay, so what we did was we were making eye contact for a long time, doing googly eyes type thing. No, I'm just kidding. No, we actually introduced ourselves, and then we started saying what we did for our particular agencies and organizations.
So you broke the ice. You started introducing yourself, seeing what you have in common. What else? What'd you do to make yourself feel comfortable in that uncomfortable situation? Yes. I'm gonna go 1 and then 2.
Oh, she was my partner. So we started off with introducing ourselves. We talked about what we did and what brought us here, and then we also talked about the question on the other side of our card.
Conversation. You went above and beyond. Started talking about the card on the question on the back. Yep.
So me and my second partner, we actually introduced ourselves and we made jokes and we switched what our card was.
Oh, so y'all switched the exercise up. Look at that innovation that comes out when I just make you make eye contact. One other one. What did you do to make yourself feel comfortable in an uncomfortable situation?
Knowing that we shared probably in a room with people with similar interests made it in a safer space. We were just talking about, like, in a public setting, if you may be more hesitant to because you don't know your surroundings, you don't know the context you're in.
Yeah, the context helped. The context definitely helped. If you were doing this exercise, if you wanted to do this exercise, this is one other thing I want to add here. You may want to think about modifying the exercise. Some folks may not be able to do certain exercises. So you heard me talk about it a little bit, like, hey, if it was tough, you can, modify it. Because there are some students or adults who may want to participate, but they just can't do that exercise. Maybe you can give them another card. But here's the most important piece that I want you guys to take away from this. Throughout this activity today, I'm going to hand it over to Julia, and she's going to talk about school safety. And there's going to be a through line. There's going to be a huge through line, and it's all about how adults connect with one another and the students that they serve. We know that it is very uncomfortable because we got to make eye contact with people that we may not know. We know that it could be very uncomfortable because I'm putting myself in a situation physically that I don't have to always be in. And we know that it can be uncomfortable because we don't have the time. I got to do this. I got this going on. I got to do this. But here's what you guys just did. You came up with plausible solutions to all the excuses that are out there as to why we cannot connect. The context is similar. The context is set. Start a conversation. Ask a question. My favorite thing on TikTok, right, is those teachers who have those handshakes before the kids come in. Bam, 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 go, let's go, right? That's connection. Those kids are connecting with someone. That adult is connecting with someone. So connection is key. It's uncomfortable, but again, we have solutions as to what to do when we get uncomfortable. So I thank you guys for being vulnerable and participating in this activity. I'm going to pass it over to Julia Andrews, and she's going to talk more about the nuts and bolts.
Thank you. Thank you, Dr. Rogers. I think connection is so very important. In 1999, when Columbine happened, I was actually, telling my age, I was getting ready to graduate. It was on my birthday. And my father was my high school principal. I'm originally from Iowa. And I remember him calling me out of class and telling me what happened. At the time, it didn't really hit me as to, okay, well, that's in Colorado. Like, why does that matter here in Iowa, a little town in Iowa, right? And so he said we're getting ready to go on at what we called a lockdown because they didn't want copycat threats. At that time, we were not doing drill. The only drills we did in school were fire drills. And so that kind of insinuated a little bit of a panic as to we're going on lockdown, nobody in or out. Parents are coming to pick up their kids. It started to be a little chaotic. And then when I got home and watched the news, I was absolutely horrified and then afraid to go back to school the next day. That was in 1999. We are here in 2022. And we have the data to prove, unfortunately, that this is not just a once-in-a-lifetime occurrence. It's happening more than we know. Take a moment to please read this slide to yourself, and then we're going to talk about it. Just take one moment to read it. As you read this slide, can anyone tell me what resonated with them after reading this? Yes. Felipe?
So 2020, 2021, there were so many schools that weren't in person. So to have 93 incidences, like, did that happen January to March? It's really, I think, breaking that down a little bit more. It's kind of crazy.
Yeah, absolutely. Anyone else? This is just schools, so we're not even talking about the outside violence that's occurring. I'm a tripper and faller, so I'm careful with this cord. If you.
Yeah, what resonated with me was the 43 incidents with death compared to the 23 that was in 2001. Even though it was a total of 93 incidents, it was 43 with deaths, which is almost twice as more as the total number in 2001.
Yeah.
So yeah.
Yep, here I come.
Just looking at it, it's really sad to see that almost every school shooting ended in a death.
Thank you. Anyone else? Okay, one more thing. Thank you.
And when you think about the the school year, how many days in the school year, and you have 93 incidents, you know, that occurred with casualties at a public and private schools, that's saying a lot. You know, it shows that what we're here for today is something that needs to be done, not even like on just a city and a county level, but just nationwide. Like, this is important that we're here and that we're doing this.
I couldn't agree more. Anyone else?
It's just devastating to see because we send our children to school in hopes that they're getting an education, and to know that, you know, in a day's time you can show up to your child's school and tragedy has struck, you know, it makes you afraid to send them out, you know, so that's what I see.
You're absolutely right, and I do want to iterate. School is still the safest place for your child during the day when you think about things that are happening outside of the school. But that's why it's so important that we have these discussions and conversations and conferences that talk about safety, but in particular school safety and what we are doing and what we can continue to do to make sure that our schools are safe. And I'm going to my next slide, which is the video.
The Texas school shooting in Uvalde, Texas has left 19 children dead and is the second deadliest school mass shooting in U.S. history. The shooting brings attention to a CDC study released in April, pointing to guns as the leading cause of death in children and teens in 2020. The data shows that gun deaths in Americans under 19 years old reached 4,368, a 29.5% jump from 2019. Firearm deaths accounted for 5.4 out of 100,000 child and teen deaths, while car crashes accounted for 5 out of 100,000. For the first time in 21 years, automobile accidents were no longer the leading cause of death in that age group. Over the years, rules and regulations have been put in place to reduce the fatality rate in automobile accidents. Similar steps have not been taken when addressing the issue of gun violence in America. According to the Gun Violence Archive, 649 children and teens have already been killed by guns in 2022.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.
I had to give him his credit for this video. So after watching this video, and this mainly was taken after Uvalde, what are your thoughts about the regulations that have been put in place or not put in place, and what the leading cause of death is among our children now? How has that resonated with anyone?
So it just reminded me, I believe in the keynote speaker mentioned, or maybe the mayor, that Texas hasn't changed any law since Uvalde. There was one at the federal level that passed, but just Texas hasn't changed any law since Uvalde.
Anyone else? I'll come 1, 2.
I was just thinking it's pretty expensive to drive a car. You got to get at least insurance, and you can run people down or whatever, but you don't have to get insurance to own a gun.
So for me, it was more or less our priorities are pretty messed up. So we're worried about abortions and things of that nature. And like, you know, people stated many times about the automobiles, but we're not concerned about gun violence. Our children who are our future, but we're not going to keep them safe. Make it make sense.
Sorry, I think for me it just shows the clear sort of agenda of
not just political parties, but lobbyists and things like that, when you can have an NRA convention the very same week as the shooting that the shooting happened in Uvalde. So I think it just shows that not only are our priorities mixed up, the lobbyists' money and things like that infiltrates a lot of policy initiatives are not folks that have a heart for kids almost anywhere.
Thank you. And while he said not a heart for kids, that's why we're here. So we're not political either side. Harris County Department of Education, the Center for Safe and Secure Schools, we're here to provide the resources and be the seat at the table. I've been challenged by our superintendent and my boss that when there are conversations about school safety, we need to be there advocating for our students. We can't really get involved in the political side, but when we talk about policies, door locking, drills, we know that drills cause heart palpitations for almost everyone. But that's where the emotional side comes into the school safety. So before or after a drill, we have to make sure that we're talking with our students and our adults and protecting them of why we have to do these drills. I'll take two more. Oh, you're close, hold on.
I think one of the things that comes up to me is how important that connection that was spoken at here earlier, and also the keynote speaker, and valuing connection, mental health, just because when I look at or hear about when there's been shootings, I always think about like that person behind the gun, what has happened to them. And it's not to excuse them, but I feel like there is a lack of connection that can lead. And then the gun accessibility that kind of makes two things come together, and it creates a huge problem. So I think it's important to prioritize making those connections with kids at school, so that at least school could be safe if it's not at home.
One more, I'm coming to you.
Thank you. My name is Karen, and I'm a volunteer with Moms Demand Action for Gun Sense in America. And if you want to get more active in keeping kids and our, families, adults, communities safe from gun violence, please come see me at this conference. We do work with lawmakers, so if you want to change laws, sometimes you got to change lawmakers. So I can help you.
Thank you. Our next slide. Oops. Just briefly is going to talk about, it's a video of what Harris County Department of Education, some of the resources that we offer, not only for educators, but for community members. Thankfully, most of our programming or training is very cost efficient or no charge at all. We've written a few grants, and so we're able to bring a lot of trainings at no charge. But I just want to show, we do an active shooter training. And I highly recommend that if this is something that you are very passionate about, that you just actually take the training so you know exactly how to act in the event of an active shooter. So we have one more video on the next slide.
The school year is less than a month away, and people are preparing here for the upcoming year. Now requires more than supplies, though, and curriculums.
Yeah, responding to active shooting incidents is now part of that preparation. And ABC 13's Chas Miller joining us now live in the studio with a look at what local districts are doing.
Yeah, Myra, it's really a sign of the times. Earlier this morning in Spring ISD, their police department hosted drills for the public and for educators to know what to do in case an active shooting incident breaks out. And then in Northwest Houston at the exact same time, educators, counselors, administrators, principals from across the region, they were meeting and learning about the exact same thing. For 5 years now, the Harris County Department of Education has hosted quarterly classes like this one. Some of those have contained as few as 4 or 5 people. But just 2 months after the tragedy at Robb Elementary in Uvalde, this session is at full capacity. 81 educators from not only Harris County, but as far away as Austin ISD.
This class has changed significantly since Uvalde, just because of the response and what is the preparation beforehand, what are the look-fors beforehand.
The class is taught by Sergeant Jeff McGowan, formerly of the Harris County Sheriff's Office and currently an Aldine ISD police officer. He started teaching these after Columbine. So how does he approach this job over 20 years later?
Take Columbine, you can take Uvalde. And basically what you'll see is that we have some of the same challenges that we had back then. But the big change is how we respond as law enforcement and some of the changes that they've made inside of the schools to make the schools safer.
For example, he discussed how law enforcement used to sit and wait for the SWAT team to arrive before they'd go after an active shooter. He also discussed how more and more school districts are investing in everything from shields to better camera systems. But for McGowan and educators who attended today's seminar, law enforcement tactics and protective equipment are far from the only tools needed to keep kids safe. There's also the psychological element.
I'm here to make sure that I can do all I can for my students and all other students, both mentally, physically, spiritually, emotionally, for their safety.
And that's why that class today was really split up into two different parts. The first part was looking at some of the signs that an active shooter could be among the school's population. The second half of that class was what to actually do should educators find themselves in that situation. Once again, Harris County Department of Education does those meetings quarterly. Live in the newsroom, I'm Chaz Miller, ABC 13 Eyewitness News.
Thank you. Lastly, I want to talk about the Harris County Safe Schools Commission. This was brought to the County Commissioner's Court in June, and they asked for each commissioner to assign a representative from their commission to form a task force and provide a report of recommendations for school districts. And I want to go over just a few, and I do have a few copies of the report. What makes this so significant is this commission was had nothing to do with political issues. It was just about how we can provide another resource and recommendations for our school districts here in Harris County. With that report, we came up with 5 top priorities: maintenance, prioritizing our facility and maintenance enhancements. Communication is huge, not just with our teachers and students, but with our responders. What we were finding is we have precincts or officers who patrol our school areas, but they've never been inside the school and form relationships. And so we are really big now on forming those relationships with not only just our police officers, but our firefighters, our EMS. In the event that something happens or doesn't happen, it's very good to have familiarity within those schools right there. And those kids and parents can also feel safe to know, I know officer such and such or the firefighters came and had lunch with us today. So we are a very big proponent of offering those relationship pieces. Training. We know that training is happening, but what we found is it's happening different and very different in different schools. And so one of our recommendations is to provide an 8-hour course for the back to school for teachers, staff, and substitutes to get school training on their emergency operations plans and what to do in the event of emergency. It does not have to be a tragic emergency. It could be weather, it could be a gas leak, it could be a train derailment. But everyone on that campus knows exactly what to do to help cut down on the chaos. The next one, resources. It wasn't until Uvalde, unfortunately, that our phone started ringing off the hook of, can you help us? We've been around since 1999, and we don't ever want another tragedy to happen to where people are calling after the fact. And so our programming is to provide preparation and resources for our school districts and community. And lastly, accountability. So measuring the follow-through and responsibilities on all levels. That goes from the parents, the crossing guards, the janitors, the teachers, the PTO. Everyone has a stake in school safety, and that's what is so important. And so all the report is online, and I'll give you the website in just a moment, of how we are contributing to providing a safer space for our students. Lastly, I want my team just to come up really quick. I have 2 specialists, and I'm surprised that they're able to be here today because they've been in schools nonstop. So thank you all for being here. I just want them to touch on a little bit about what they do and the resources that I provide. They didn't know I was doing this, but thank you. First is Janice Wallaby, our school safety and security specialist.
Thank you so much, Ms. Andrews, for giving me the opportunity. She's right. We're very, very busy, but we had to take the time to connect to what they are connecting us to, the school violence. I do emergency management. I'm in these school streets doing safety audits. Have been in these streets for a while doing it. It just didn't come up because Uvalde. We've been doing safety for a while in Texas, but we're also doing it with Fidelity this time. I'm going and asking another questions. One connection that I want to make that I made in the main tent was about public policy versus public panic. I go out to talk about safety policy versus safety panic, about looking at what we're doing, how we're doing it, is it the right thing, what do we need to change, what do we need to improve, what are the things that I observe, what are the things that they're seeing, how do we write that up so we get the support we need. But it all ends up, we have to stand up for it, we have to fight for it, and we have to be about it. So emergency management is my deal. There's a lot of different things on that handout that you can look at. And I'm the hard side, and I'm gonna give it to my soft side.
Every time she says that, it makes me feel like I need to work out a little harder. All right, y'all, my name is Sasha Blake. I am the climate and culture specialist. So again, I'm the soft side. I do everything like SEL, restorative practices, and then my wheelhouse and what I love is trauma-informed practices. And what I really try to work on and educate people is that trauma-informed and restorative practices are a whole cycle. It doesn't happen just when there's harm, it happens before that. So we create intentional relationships so that way when harm is done, we can restore the process. It also gives us a lens. So what they talked about with Sergeant McGowan is that there are often signs and symptoms before something happens, right? Like when we've created those relationships, like our activity that we started with, we are more apt and more able to see, hey, there's something a little different right now, right? And it doesn't have to be as egregious as a school shooting. It could just be like our kids are suffering mental health illnesses and challenges. So that's what I do and love doing, and I'll pass it back to Julia or Dr. Rogers.
So we wanted to save time at the end for any questions, comments that you may have, and any ways in which we can assist. So I see one here. Now I may not be the one. I'm just a high-profile Vanna White. I may kick it off to somebody else, but I wanted to lead this.
So what do you guys do in regards to teaching our kids to take the training seriously? Because I've seen a lot of the kids, whenever we have these kind of drills, they kind of take it as a joke. They'll say, hey, let's make some noise so the shooter can't find us. How do you guys combat that?
So the question was, how do we have kids take the drill seriously?
That's the culture piece, creating that, cultivating culture of school safety. And so that's the conversations that need to be happening not only in school, but at home. But our teachers need to feel comfortable and equipped with the necessary verbiage. And so that's where we can come in support of, we do not want to scare them to death, but in the event this happens, this is why it's so important. But having those community meetings and bringing those responders in to also talk. Sometimes, when our parents talk to us, we just whatever. But when someone else comes in, they may take it more seriously because the Chicago incident this summer, July 4th, those children knew exactly what to do. When those parents were interviewed, like on CNN, they were saying, my child told me they had a training and this is what we were supposed to do. It saves lives, absolutely, but having those courageous and comfortable conversations, and that's why we have to, in our schools, create a culture of school safety. We talk about it a lot, but until something happens, it kind of always goes by the wayside after a few weeks. So having other people come in to support your students and your staff about that is going to be key for you.
And so what I hear you saying is, it's not just an overnight process. It's having those conversations beforehand and after, but then also talking to the kids on their level. A lot of times as adults, we talk to them from an adult lens. Oh, you need to take this serious, or you better take this serious, as opposed to really getting at and asking the questions, hey, how do you feel about this? Like making it a two-way street. Next question.
Hi, everyone. My name is Sonia Corrales, and I'm with the Houston Area Women's Center. And so my question was, first of all, congratulations on everything that you're doing. And I think all of the things that we do that are reactionary, we have to do that. I understand that. And that's important, right? So that we're prepared in case something happens. My question is about more of the upstream. Like, what are some of the things that you're doing to implement the strategies to prevent from this even happening in the first place? So maybe some of the emotional, social-emotional learning, those kinds of things.
So the question is around the preventative services that are offered. Who do you want me to toss that to? Tasha?
I love talking. So it's really a variety. So what I do is I'll work with schools, campuses, districts, individuals, and what we really try to do is make sure it's not like a shotgun, bad analogy. It's not one size fits all, right? And so, because what's happening on one side of the city may be happening a little bit differently, and we want to make sure that our programming is responsive to the needs of that particular school or that district, and then help them with the culture and climate. So it could be anything from going in and doing an all-staff training on restorative practices and how do you implement those proactive strategies. So what's the best way to do it? Now, back to the question too about like people who kind of kick back, right? So how do you also create buy-in? How do you get people to understand the why? So we usually go in and we start with the why, like why do we do this? Why is it important? And then we go to the what and the how. So that way they understand like we are creating systems of safety. So that way our emotional safety will lead to our physical safety. And so I think, does that kind of answer your question? A little bit.
I mean, here's what I would add to that, right? That's why we started off with the connection activity today, right? Because again, we want to connect with the person, right? Folks are doing things because they feel disconnected, right? And so it first starts off, like Sasha was saying, let's listen. Let's not assume that, oh, we have this restorative package that we do. We're just going to do this to you. Well, some of that may not work. And so I need to know what your triggers are. I need to know what makes sense for you so that I can effectively support you, right? One person, I may be able to come in and I may be able to do one thing, and that works perfectly. But then another person, I may need to continue to come back and triage. And there are different things that trigger, right? And so really the key here is making sure that we are focusing in on the preventative measures, because oftentimes we don't. Other questions? We'll go here, 2, and then 3 in the back.
Good morning. My name is Angelica. I got a question. Do you know if it's any hotline or a website or something? Because one of the points on this with the kids is also like sometimes they have scared about to report, or sometimes they even report but nobody cares, so they don't check it like a red flag, like is something happening. So I'm not sure if it's any hotline specific for the kids, like they want anonymous law or something, report about what is happening around his school.
So the question is, is there a hotline or a support line for students to, if they want to report, to do so anonymously? So I'm going to pass it on.
The state just released a I Help Texas website, and it's an anonymous reporting tool. So they can, you can go online and put in the information, and no one will know who reported it. Every school district has their own, but the state of Texas and Texas School Safety Center just released it 2 weeks ago. So however they feel safe to confide in someone would be better, but that tool is there just for that reason of students who don't feel comfortable.
Over here.
Out of curiosity, I do know that learning styles and things like that should be taken into account, but when you guys are given the trainings, what type of follow-up or what does that look like? And then also in areas where, I don't know what the capacity is like for you guys, but if there's a side of town or school district that needs more training, what does that look like?
That question brought a smile to my face. And they'll know why. What kind of follow-up is available? And the reason why, I couldn't have tell me what's your name? Charmaine. Thank you, Charmaine. So my biggest push has been, hey, look, restorative practices, social emotional learning, it's not a one-stop shop, right? Meaning, or a one-touch point shop, right? We can't just say, help, we had this great circle, you're cured, go off and have a great time. And what this team has done a great job of, and I'll let them talk a little bit more about, is they've been very, very intentional about how do you wrap around the supports and provide, and what does each touch point look like? Because they all can't look the same. Each touch point has to be different. So I'm let them talk a little bit more about that.
Thank you for that. So you're very right. You're very correct. And when you say different trainings, what it looks like, different sides of town. So we are a resource. And so we're not commanded to go into any school district. We actually have to be invited to go into those school districts and offer the training to them. So if you know of a school that's struggling, you can give them our information, but we are just a resource organization. So we don't just go to support all the school districts. So that's sometimes a misconception. But once we're there, we tell them we're there to stay. If it's for the year, if it's for 2 years, we're not just gonna give you this training and then leave. We wanna follow up. If you have a parent engagement center and you think some parents need some training, we also offer the youth mental health first aid. So if you have some people who wanna take that, luckily we have a grant for most of these trainings for our community. And so they're at no charge, and that's what we're trying to get out is the resources are available and they've been available. We just need to be at the right place, the right invitations to our schools and in our community to provide these trainings. And we want to stay within these schools. I much would rather be in a school than be in an office every day. So we're definitely here for the support.
Yeah, that makes 2 of us. All right. I think we have time for 2 more, 1 and then 2.
Hi, my name is Jared Fields, and I'm the Education Equity Director for the Social Justice Learning Institute. So in a sentence, we train high school students to become social justice warriors. My question for you all, when you were all in schools, like, is there a difference in your conversations with how students are shaping their understanding of school safety and what we're saying, right? So just essentially, like, are students sharing the same concerns for something over Uvalde, or are their ideas of safety a whole lot different?
Great question. Thank you, Jerry. So are students sharing some of the same conceptions or misconceptions that adults are sharing, or are their viewpoints different?
And I'm glad you asked that because it depends on the school and the culture of the school. So some schools, they're like, that's not gonna happen here. We don't have kids that look like or fit the profile of a shooter. If someone's gonna come shoot up the school, they're gonna target that one person that they want to shoot. Then we can go to the other side of town and there's a whole different conversation going on based on the culture of that campus or of that school or of that community. It most certainly could be a possibility because unfortunately there's a profile with our school shooters. It doesn't mean that that profile can change in an instant because it absolutely can. And so that's why having the resources, having the conversations, and creating that culture of safety is going to be so key for all of our students to feel safe. From pre-K babies, when Janice was doing some audits, we have some early childhood centers. Those are 6-week-old babies. They can't do anything, and they may only have 2 teachers in there. So what is the plan for keeping them safe if a shooter were to go into one of our early childhood centers? And so those are the conversations that we're having with our districts and Head Starts of, we have to create a plan, regardless if we never use it, but everybody needs to know that plan.
And you hear us talking a lot about creating a culture. Again, this is something that we're not just dropping at school districts' feet. We're saying, hey, we can help you do that. We want to get in the work and help you do that. And we've been able to partner with a lot of like-minded districts to do that type of work. Last one.
Okay. Hi, I'm with Harris County Resources for Children and Adults, and this is more so like an observation. But what I've been noticing as I'm going into homes and working with the families is a lot of the parents aren't being supported. Their youth may have significant mental health. They have tried countless, interventions, whether it be counseling, medication, which is also a problem because, if they're irate or if they're out of control, they can't get them to take their medicine. So how are we supporting those families? I've even had a parent tell me that, they have concerns like my son might be someone that might be an active shooter one day, but she doesn't have the support that she needs. There's no placements, there's long lists. I mean, it's just, there's nothing for them, so.
That is a great question. So how do we support families? I'm actually going to take this one and I'm going to have you finish off. That's why events like this is important, right? So you have two main takeaways that we're leaving you here with today. The first is the content, right? Connections matter. Here are certain things that, here are some recommendations. But the second, which is equally important, that I want you all to understand is that the expertise is actually right here in this room. So the connection activity, yeah, it was the icebreaker, but it was also for you to leave out of here with some business cards. Because again, the majority of our work is with schools, right? And we support families through schools. But there are folks who work in here directly with families, and together, this isn't just a Harris County Department of Ed. This is a Harris County issue that we all can solve for together, right? And so before you leave here today, I want you to make sure that you're picking the brain and you're having some conversations, water cooler conversations with one another, because the answers to a lot of this doesn't just reside with us, it actually resides with everyone in this room. All right. Really quickly, because it's time, we're over by 1 minute. We do apologize. We thank you all for being vulnerable. But Julia, can you get up and tell folks where they can find us?
Yep, you can find us on our website, hcde-texas.org, and I think we can put it up here. We are here. We have actually 25 divisions within Harris County. And so we have Head Start divisions. We have therapy services divisions. We have a schools division. So any resource almost that you think you might need of support, Harris County Department of Education can support you, or we can find a way to get you the support that you need. And so can we put the last slide up of how you can find us directly on the website? That's where we are on our website. Dr. Rogers and my team have cards. If you'd like cards, we have more handouts with our information and resources available. So we want to thank you all for attending, and we'll be here. I know it's the lunch session now, but we'll be here for a little bit if you have an individual question. Thank you.